Patient load for any healthcare organization fluctuates. It's just a fact of life for any healthcare professional. This ebb and flow is designed into all organizational plans. But when you add the current healthcare climate, things can get even tougher. Emergency departments throughout the U.S. are overwhelmed with patient population issues. It is critically important that every hospital have a flexible solution that scales with any patient load. This solution must allow any area to be set up for patient care. Once the patient load requires hallway patient management, safety and efficiency are put to the true test. How you treat those patients in the unconventional areas is the challenge and the major concern. Now ask yourself, does your plan have the physical means to support your staff and provide the continuum of care to your patients? With a plan in place, and equally as important, the equipment to support your plan, you can safely and efficiently take everything you need for emergency patient care whenever and wherever it is needed. Okay, I'm going to stop you here. What happens when you have a mass casualty event? When this kind of patient surge occurs, you are left with no other option than to use areas that were never designed for patient care. So now is the time to ask yourself, how effective is your plan to manage both small and large-scale surge events? Do you have the tools available to provide continuum of care throughout these events? Another question to ask yourself, can you maintain the safety and effectiveness of your caregivers throughout the event? The mobile treatment station is the ideal solution for patient surge needs. This station is fully customizable to the end user's requirements with a complete line of accessories. This flexible system can be configured for hallway patient management and mass casualty patient management. This treatment station can even be configured for forward triage in the waiting room. Now stop and think about that for a second. You can set up a system that will turn chaos into a quick and efficient method to evaluate patients as they walk through the door. Imagine if you could forward triage the worried well away from your high acuity areas. Now that is a truly flexible system for patient treatment. I'm betting you mostly think about equipment management rail inside patient rooms. But with a little planning, equipment management rail should be installed in any clinical hallway and even the non-clinical areas. This easy solution can then give you the flexibility to turn any area into a patient treatment area. Another much needed solution is how to safely and effectively deliver medical gas and clinical support equipment into non-clinical areas for mass casualty and major fire events. Paladin has a solution in their freestanding equipment management system, which helps to bring order to an otherwise chaotic environment. It deploys in minutes, can set up on rough terrain, and can simultaneously supply 8 victims with oxygen. Even better, this system is so flexible it can be placed into any environment, including mobile. So ask yourself, do you have a demonstrative plan in place to address the demands set up on healthcare by the Joint Commission, CMS, and the NFPA? Paladin can supply both the equipment, and they're also there to help in your planning.